A very good afternoon, everyone. Let's begin with today's class. And we are going to talk about calcium and copper in today's class. And as we say in the beginning, that let's crack NEET PG together. So, a very good afternoon, everyone. Let's crack NEET PG together. So, the topic of today is calcium and copper. We'll be talking about these two minerals in detail. That is, we'll be talking about the introduction, then sources, then recommended daily allowance, how they are absorbed, what are their biochemical functions, how are they regulated or how their level is regulated in the body, and what is the clinical symptom in case of their deficiency or in their excess. This we are going to talk in today's class. But before moving with the topic, actually, let us have a small introduction about the educators of Unacademy. So these are some of the best educators who teach at Unacademy, and you will be getting the India's best educators on the platform of Unacademy. And Unacademy is one of the India's largest platform for the preparation of NEET PG examination. So this is one of the easiest way through which you can prepare for your NEET PG examination. Then there are special classes at Unacademy, and what is so special about these classes is that you can directly go to your faculty member and ask your doubt. They'll be very much willing to solve your doubts. So that is the special thing. Like there are so many online other classes also, but what's so best about Unacademy is that faculty members, they'll be solving your doubt in the live classes, right? So in today's time, this is one of the best way, as one cannot move out, and because of the lack of time everywhere, one has to opt for the online options, and Unacademy is one of the best amongst all the online platforms. Then there are test series, and as I always say, for qualifying any kind of competitive exam, what is most important is to know the pattern of the examination and to know what type of questions will be asked. So very much acquaintance with the MCQs and PYQs make us very well versed during the examination. So that is also possible with Unacademy, as Unacademy conducts weekly mock tests and free mock tests every now and then. So these test series are very much important in the preparation of the examination. Right, then this is one of the easiest way for the preparation, as I told that you don't have to be present physically over there, so there is flexibility in the schedule. If you are not in the town and some class is going on, so you can anywhere log into the website and you can just start learning. Then language can be of your choice, as there are many educators who even teach in the regional languages, so they are helping out those students who prefer the regional languages. Then unlimited practice. Once a quiz has been taken or a video has been recorded, then you can go through it as many number of times as you want to. So this unlimited practice also makes it one of the most desirable platform. Then it is very easy to enroll. You can just download this Unacademy learning app from the Google Play Store, and from there you will get the app and you can just log into app, and you are good to go. You will be eligible for all the free classes. Those are the special classes. Then you won't feel anything different than a normal classroom, because in a normal classroom also we can ask doubt with the educators, and here also one can ask that doubt with the educators. Then there are interactive polls, and faculty members, they'll be giving you 3-4 options, and you will have to select the one of the option, and they'll be even explaining that what are the reason for the other options not to be correct and why the particular option is correct. So it's a very interactive kind of feeling in the classroom. Then you can learn anytime, anywhere, as I told, if you're not physically present in the town where your classes is going on. So no matter, no worries, you can anytime just log into the app or YouTube, and you can continue learning that particular topic. Then there is this plus subscription, and on this plus subscription you'll get all the 19 subjects over there, and in these 19 subjects all the topics will be covered very nicely in a very systematic manner, and The faculty members, they also conduct the short-term courses, crash courses, timely according to the upcoming exams. So the Plus subscription has helped so many students all over India to qualify the examination. So you can also be one of those privileged students who got the opportunity of being mentored by these best faculties. So just go for this Plus subscription, and you can also go for 1 monthly to 24 monthly subscriptions. But what I would personally suggest is go for a 12 monthly or 24 monthly subscription, because then it will be like you will have enough time to go through all the lectures which is available, and there are so many versions of each and every topic also, because many different faculty members have taught that particular topic. So this is one of the best part, that you can go through all the lectures very nicely in a very systematic manner. So just go for a 12 monthly or a 24 monthly subscription. Then in this Plus subscription also you can get a additional 10% discount if you are using my referral code, that is FB01. So don't forget to use my referral code, that is FB01, and avail an additional 10% discount, and just go for it and you will be benefited definitely. Now, starting with the topic, that is calcium. Calcium and copper. First, we'll be talking about calcium, and then we'll be talking about copper. The first thing is calcium. So, in calcium, what we are going to talk is introduction, sources, RE, and all. So, starting with introduction. Starting with introduction. So, the total amount of calcium that is present in body is 1 to 1.5 kg. So total content of calcium in the body, total content of calcium in body is 1 to 1.5 kg, and amongst this 1 to 1.5 kg, 99% is present in bones and teeth, and remaining 1% is present in extracellular fluid, right? So the total content is 1 to 1.5 kg, and from that also 99% goes in bone and teeth, and only 1% is responsible for the extracellular fluid. Then talking about the sources of calcium, everyone knows it quite well, that calcium is present abundantly in milk, then milk products, then it is present in meat, eggs, fishes, vegetables, then cereals and pulses. These are some of the sources of calcium. Then talking about the recommended daily allowance of calcium. So for adult, it is 800 milligram. For children, it is 800 to 1200 milligram, or can say 1.5 gram. Then for pregnant and lactating lady, so in pregnancy and in lactation, 1.5 gram. And also this 1.5 gram is applicable for menopause. So this is the recommended daily allowance of calcium. 800 milligram in adult. In children it is 800 to 1200 milligram, or 1.5 gram, and for pregnant and lactating and menopause women it is 1.5 gram. right? So this is about this RDA. And now moving further about the biochemical functions of calcium. So biochemical functions. What are the biochemical functions? So first is bones and teeth formation. Bones and teeth formation. Then calcium along with phosphorus. This calcium along with phosphorus, it forms hydroxyapatite. And this helps in mineralization of bones. Helps in mineralization of bones. Right. So next biochemical function is that is also responsible for contraction of muscles. Contraction in muscles. Then as it is required for contraction in muscle, what does it do? It increases the action of actin and myosin. Increases the action of myosin and actin, right? Then it is also responsible for facilitating the excitation and contraction coupling. So facilitates excitation contraction coupling. Facilitates excitation contraction and coupling, right? Then talking about some other functions, like let's take another slide. So what's the number? Yeah, it's 7. So seventh function is it is important in coagulation as well. It's important for coagulation factor 4. For coagulation factor 4. So what is the actual role? This calcium, it is positively charged. It reacts with prothrombin. Reacts with prothrombin, and this prothrombin is actually negatively charged, right? So the combination of calcium and prothrombin is because of the opposite charges. And when calcium and prothrombin they react, they perform the gamma carboxylation reaction. Gamma carboxylation reaction. Right, it performs gamma carboxylation reaction, and because of this gamma carboxylation reaction, what will happen that there will be formation of thrombin from prothrombin. Prothrombin will give rise to thrombin. So actually how does this all happens is what is activated, gamma carboxy glutamic acid, gamma carboxyglutamic acid, which is required for coagulation factor 2, 7, 9 and 10. So because of this, there is activation of vitamin K, activated vitamin K. So like this, the prothrombin is converted into thrombin with the help of calcium ion to gamma carboxylation reaction. And this is the whole thing, that why it is responsible for coagulation, that how calcium is responsible for coagulation as well. So the biochemical function is coagulation, right? Let us move further. Uh, it is also responsible for maintaining the integrity of membrane. Maintains the integrity of membrane. So this is our eighth biological function. Maintains integrity of cell membrane. So integrity of cell membrane is maintained, and it also takes care of permeability and transport of ions across the membrane. So it also takes care of the permeability and transport of ion across the cell membrane. Fine. Then other functions are it acts as secondary messenger in hormone action. Acts as secondary messenger in hormone action. In hormone action. So in which hormone action? The IP3 DAG pathway calcium acts as secondary messenger. So this particular pathway is for glucagon, secondary glucagon synthesis, and here the calcium, it performs the role of secondary messenger, right? So what does it do next? It is also responsible for release of hormones, for release of hormones. So the hormones which are released in action of calcium is insulin, then vasopressin, parathyroid hormone. These all hormones are released in response to calcium action. Right. Let's move towards the next biochemical function, that is the 11th one. So it is also responsible for activation of enzymes. Activation of enzymes. So the enzymes which are actually activated by calcium, let us just um, revise the names of the enzymes. So it is calcium magnesium ATPase, then pyruvate kinase, pyruvate kinase, then adenylate cyclase, adenylate cyclase, then pyruvate dehydrogenase, pyruvate dehydrogenase, then it is also responsible for action of pyruvate carboxylase, pyruvate carboxylase, then it is also responsible for glycogen synthase, glycogen synthase. So these are the enzymes which are actually activated by calcium. Activation of enzymes by calcium. So these are some of the enzymes. Then next function of calcium is in nerve impulse transmission. Nerve impulse transmission. Right. Then next function is it is quite responsible for various secretory processes. Responsible for secretory processes, and also responsible for various endocytosis and exocytosis. various endocytosis and exocytosis reaction. And in heart, the next function, that is it is our number 14. Number 14. It also prolongs the systole in heart. So it is also responsible for prolonging systole. Prolongs systole. Right. So we have seen some around 14 biochemical functions of calcium. Right. So enough biochemical functions, so you can remember the biochemical functions. Then let us move towards the next thing, that is regulation. That is regulation. So how is it regulated? Regulation. So it is mainly regulated by three hormones, that is parathyroid hormone, then vitamin D, then calcitrol. And the serum calcium level for normal, serum calcium level for normal, it should be around 9 to 11 milligram per dl. This should be the normal serum calcium level. So what are the functions of this serum calcium level? So if we are saying it is 9 to 11 milligram per dl in serum, so what are the functions? So 10% in association with bicarbonate and phosphate. 10% is in serum calcium is in association. 10% is in association of bicarbonate and phosphate, and all others also, bicarbonate and phosphate. And 50% calcium is free. 50% is free, is in free form or ionized form. Then rest of the 40% is protein bound, that is in enzymes and various other proteins. So protein bound, right? So this is about the serum calcium level. Then talking about the individual hormone which regulates the level of calcium. So first one is vitamin D. What happens is, if vitamin D is there, it will increase the absorption of calcium from intestine. That so it will increase the absorption of calcium from uh, intestine, and this it does with the help of cal-binding protein. Cal-binding protein. With the help of cal-binding protein. Then it is responsible for bone mineralization. Bone mineralization. Then it increases the absorption of calcium and phosphorus from the renal tubule. Increases absorption of calcium and phosphorus from renal tubules. Right. So this was about vitamin D. The next is parathyroid hormone. Parathyroid hormone. So it is responsible for demineralization, and decalcification. the two important functions. And it also increases the vitamin D, increases vitamin D. And if vitamin D is increased, there will be increased absorption of calcium from intestine and renal tubules. So it is responsible for demineralization, decalcification, and increased vitamin D level, and which will be indirectly linked with increased absorption of calcium from intestine and renal tubules. Then talking about calcitonin. What are the functions of calcitonin? It decreases the serum calcium level. Decreases the calcium level in serum. And it is important for mineralization of bone. Important in mineralization of bones. Then it decreases the reabsorption of calcium. Decreases the reabsorption of calcium. And it also decreases the intestinal absorption of calcium. Decreases intestinal absorption of calcium, right? So absorption, how it is absorbed positively and how it is deabsorbed, this we have seen. Now this absorption of calcium, whenever there is absorption of calcium, it is always against the concentration gradient. Against the concentration gradient. That means always ATP will be spent. Expenditure of ATP will always be there, right? So let us write the key for this. Let us write the key that absorption increases by vitamin D, parathyroid hormone, lysine, arginine, and low pH and lactose. These all things actually increases the absorption of calcium. And what are the factors which actually decreases the absorption? So absorption decreases by phytate, then oxalate, phosphate, then high pH, then dietary fibers, then free fatty acids. Free fatty acids. These are the factors which actually decreases the absorption of calcium, right? Now let us talk about some of the tests which is used for determining the serum calcium level. So serum calcium level is estimated by serum calcium level is estimated by. So first is Arsena 20 method. Arsena 20, and second is O-cresophthalin complexome. O-cresophthalin complexome. Right. So this is how the serum calcium level is estimated. Now talking about the clinical significance. of calcium. Clinical significance of calcium level. So it can be seen like this: convulsions, then arrhythmia, then tetany, then spasm, right? So these are the clinical significance. So talking about the causes of calcium deficiency. Causes. So the causes are rickets. The causes or the things which is caused is rickets, osteomalacia, then osteoporosis, then decreased parathyroid hormone activity, decreased parathyroid activity, and medullary carcinoma of thyroid, medullary carcinoma of thyroid. So talking about the level, that if it goes below certain limit, so what all things will happen. So if it is below 7 milligram per TL, it is declared as medical emergency. Medical emergency. Then it is also called as tetany. Also called as tetany. There will be flexion of the wrist. Flexion of wrist will occur. Flexion of wrist. Then extension of fingers. So talking about the treatment for tetany, treatment, injection of calcium gluconate, injection of calcium gluconate 10% is given, 10 ml over 10 minutes. 10 ml over 10 minutes is given, and then there will be a maintenance drip. Maintenance drip. So this comes in the treatment of tetany. Then talking about hypercalcemia. Hypercalcemia. So whenever the serum level is greater than 11 milligram per DL, it is called as hypercalcemia, right? So when does hypercalcemia occurs is in parathyroid hormone tumor, then in secondary metastasis of bones, secondary metastasis of bones, then in hyperparathyroidism, then in bone tumors, then in multiple myeloma, that is the Paget's disease of bones. Paget's disease of bones, right? So we have talked about the hypocalcemia and we have talked about hypercalcemia. So this thing we had seen about hypocalcemia. hypocalcemia if the level is below 7 milligram, and if the level is more than 11 milligram, it is coming under hypercalcemia. So I think we have covered almost everything related to calcium. Now coming to copper, the second thing that we had to discuss in today's class, the second thing is copper. So copper is a trace element. The trace element, then total content of copper in the body, total content in body is also quite less, that is 100 milligram, and this 100 milligram is widely distributed all over the body. Then talking about the sources of copper is organ meat, then green leafy vegetables, then fruits, nuts, shellfish, cereals. These are some of the sources of copper. Talking about the RDA, recommended daily allowance of copper, is also quite less, that is 2 to 3 milligram per day. 2 to 3 milligram per day. And for children or infants, it is 0.5 to 2 milligram per day. So this 2 to 3 milligram is for adults, and for infants and children, it is 0.5 to 2 milligram per day. Then talking about biochemical functions. Biochemical functions. So it acts as cofactor for various enzymes. Acts as cofactor for various enzymes. So what are these enzymes in which it acts as cofactor? Let us highlight the names of the enzymes. So they are cytochrome oxidase, then catalase, then ceruloplasmin, then ALA synthase, then superoxide dismutase, and tyrosinase, and it is lysyl oxidase. So these are some of the enzymes in which copper is used as cofactor. Right now, talking about all these particular things, we have said that it acts as a cofactor in these enzymes. So first of all, when we are talking about cytochrome oxidase, it means it is involved in electron transport chain. So involved in electron transport chain. Next, when we are talking about ceruloplasmin, so what is the function of copper and ceruloplasmin? So the ceruloplasmin is actually involved in conversion of ferrous iron into ferric form. Ferrous form of iron into ferric form, and this ferric form, it attach with apotransferin. apotransferrin, and this apotransferrin gets converted into transferrin. So copper is actually involved in formation of transferrin, right? Then third, when we are saying ALA synthase, so this ALA synthase is responsible for heme synthesis. So our copper is also helpful in heme synthesis, right? Then the fourth, we said superoxide dismutase. Superoxide dismutase. So superoxide dismutase. So this superoxide dismutase acts as an antioxidant. It acts as an scavenger of free radicals. So copper is responsible for the antioxidant activity as well. So this is how it acts as antioxidant, because it is responsible for the function of superoxide dismutase, which is a scavenger for the free radicals, right? Then the next is, it is responsible for the function of tyrosinase, and this tyrosinase is responsible for melanin pigment or melanin synthesis. So copper is responsible for melanin synthesis as well. Then lysyl oxidase. So the function of lysyl oxidase is vessel formation. So in that also copper is playing an important role. Now talking about the diseases related to copper. Diseases related to copper. We'll be highlighting the name of the diseases and then we'll be talking about them. So first one is Wilson disease, which is very important to know. Wilson's disease. Second is anemia. Then CVS abnormalities. Then it is Menkes Kinky hair syndrome. Menkes Kinky hair syndrome. Then it is also responsible for, its deficiency can lead to hypopigmentation. Right? And it is also responsible for hepatolenticular degeneration. So that we'll be seeing now. So what happens whenever there will be a mutation? In copper binding ATPase. There will be accumulation of copper in liver, because this copper binding ATPase CBA is responsible for transfer of copper. Transfers copper from liver to bile. It is responsible for this function, and if it is defective, it will lead into accumulation of copper in liver. Accumulation of copper in liver will happen, right? So there will be accumulation of copper in liver, and it will lead into formation of this brown ring in the cornea. Brown ring in cornea. So it is brown, or mostly it is golden also. So this ring in the cornea, it is formed in the decimate membrane. So that will be affected, and this is the characteristic feature of Wilson's disease, characteristic of Wilson disease, and it is a kind of autosomal recessive disorder. Autosomal recessive disorder, right? And this is also called as Kaiser-Fisher ring. This called as Kaiser-Fisher ring. So the ring is covering the decimate membrane of cornea, and it is golden in color, and it is the characteristic of Wilson's disease. So second thing that we have seen because of the abnormality in the copper level is anemia. So this will be kind of normochromic microcystic anemia. Normochromic microcystic anemia. And it will also lead to various CVS. That is, the walls will become fragile. Walls will be fragile, and there will be rupture of aorta. Rupture of aorta. Rupture of aorta. Right? And this rupture of aorta is also linked with aneurysm. So Wilson's disease, anemia, CVS, and Menkes Kinky hair syndrome. Menkes, this Kinky hair syndrome. So it's a kind of X-linked disorder. This X-linked, and it affects the male child. Then there will be defective copper binding ATPase. This will be defective. Then absorption of copper will be normal. The absorption is normal. But this copper binding ATPase is defective, so copper will be trapped in the walls. Copper trapped in walls. And this, because of this, there will be excess of copper. Excess copper in cells. Right? And because it will be there in excess, there will be hypopigmentation. Hypopigmentation, right? And actually this hypopigmentation is because of defective tyrosinase activity. Defective tyrosinase activity. Right? So remember, this Menkes Kinky hair syndrome is also because of defective copper binding ATPase, and it is X-linked and affects the male child because just one X chromosome will be there, and if it is defective, it will cause Menkes Kinky hair syndrome. So copper will be trapped in the walls, and it is the hypopigmentation condition, and the tyrosinase activity is defective. There will be actually normal absorption of copper, so there will be excess of copper in the cells, but it won't be available for the further thing. Then anemia, it will cause anemia, and the anemia will be normochromic microcystic anemia. There will be fragile walls, and aorta will rupture. Then talking about the Wilson's disease, there will be Kaiser-Fisher ring in the cornea, that is brown colored ring in the cornea, and this also occurs because of the mutation in copper binding ATPase. So like this, we have covered almost all the topics which are related to calcium and copper. We have covered the major minerals which we need to study in biochemistry, and hope you people have understood the things well. If you have understood well, please comment in the chat box, and you can also tell me the topics which you want to study in biochemistry, so that whenever I'll be going through your comments, I'll be just knowing that which topics you want to study. Then lastly, as I always say, let's crack NEET PG together. Please subscribe our channel, that is Let's Crack NEET PG, and for getting all the notifications, please hit the bell icon, and for getting an additional 10% discount in the plus subscription, please use my referral code, that is FB01. So this is it for the class. Hope you people have understood the things well. I can see many students, they have joined very late, like I can see they have joined just now. So just go through the lecture whenever you are getting the time, and you will understand the concepts. So it was like quite easy to know and learn about calcium and copper. So have a very good day. Keep on studying. This is it for today's class.